And I had to think about it because there's so many things to talk about, but here's a very, very quick thing that I mentioned to Albert, and he said, you know what, I'd love my clients to know that. And here's the little thing. If I'm talking to a patient and I see some amalgam, and I see that the amalgam has been there for many years, it's got a little bit of a defect around it, very often if I were to say to the patient, you know what, that amalgam needs to be changed because I think it may be suspect, you'll get resistance with a lot of people because they'll think you're just trying to make more money and just get rid of their amalgams for no good reason. So I explained to Albert that the science is actually quite clear. If you looked at all the science, you would understand, number one, that the coefficient of thermal expansion between 20 degrees and 60 degrees is a relevant piece of information. So a tooth expands at a certain rate. Porcelain expands and contracts at the same rate as the tooth. So when you've got porcelain inside a tooth, there's no difference with the temperature change. When you put amalgam inside a tooth, and if you look at the numbers, and I've got them all, amalgam expands twice as much as the tooth. So it has the capacity of cracking teeth. In fact, composite will expand and contract 4.5 times as much as the tooth. And so that has an effect as well. And so all we need to do is explain that little thing to patients and then show them some pictures of, and I've got them like a pinhole amalgam that's been there for many years, and you can see when you look at it, it's got cracks all the way through it, and when we take out that amalgam, it's all black and decayed inside, and yet from the outside it looked perfectly okay. So by aggregating a few photos that are relevant, giving the patient just a little bit of technical information and being able to show them in their own mouth or with a photograph blown up of their tooth, they can very quickly understand what's potentially going on. And instead of trying to say you need to have a ceramic, you just give them the information about what will happen if it stays as it is, and also what would happen if we just put in something else like composite. And they will already know, you know what, I don't want to leave it as it is because it's a risk. I don't want a product that expands and contracts 4.5 times. Maybe I should have the porcelain. So the patient's now asking me for the ceramic instead of me telling them about it. So I'm not having to sell, they're basically selling themselves. All you have to do is tell them what it is that's happening and that they can understand that. So when I explained that to Albert, he was excited. He said, I'm going to rush off and make sure that all my fillings are with the right material, and really that's the way we want to go with our patients. No sales, just let them make the right decisions. Thanks very much.